Welcome to The Pursuit of Health, the podcast on health policy for a free and modern society. Welcome, everyone, to another episode of The Pursuit of Health. I'm your host, Reinier Schuur, and joining us back on the show is Dr. Colleen Smith. Welcome back, Colleen.
Thanks for having me, Ray.
So today we're going to be talking about the New York Health Act. This is legislation that would introduce single-payer healthcare in New York State. It's a idea that's been kicking around since at least the 90s, and it hasn't had much success since, but it hasn't really died either. But the reason why we wanted to talk about it today is because these notions of having single payer at the state level is an idea that's been getting more and more traction over the years. And you also see this with ideas on the federal level with Medicare for All. So we thought we would take this opportunity to actually look what's in the bill and discuss what's objectionable about it. So, Colleen, what's in this bill?
It's a pretty broad bill, but essentially, the bill would replace most private and public health plans in New York State with what they're calling provisionally the New York Health Plan. This would be a broad healthcare coverage that includes pretty much anything you can think of that's covered by Affordable Care Act plans, that's covered by most employer health plans, and also that anything that's covered by Medicare or Medicaid, so the government plans. It kind of proposes subsuming them, so using all the funding that comes into the state federally or that is made by the state, and also instituting a payroll tax that would be paid by employers as well as employees, to cover the financial cost of the bill or of the health plan. And it's basically healthcare for all, includes emergency care, primary care, and charges no premiums, no deductibles, and no copays or coinsurance for anyone who lives in or works in New York State. It also includes, or it specifically states that people will be covered regardless of immigration status. So it includes immigrants, both legal and illegal. It has a few other key things that it does. It does say that it allows patients to use any participating provider with it has no insurance in network or out of network kind of delineation, because everyone would be assumed to be in network. And the other kind of key thing that it does, which I think is really important, is that it prohibits private insurers from selling insurance in New York State that duplicates any service that would be covered by the New York Health Plan. And as I already said, the New York Health Plan basically covers anything that would be covered by Medicare, Medicaid, your employer insurance, or Affordable Care Act plans. It also covers long-term care benefits, which is also important to point out. So I guess maybe, Ray, we should talk about some of the implications of this of what this coverage kind of mandate would be.
Right.
Interestingly, the
Go ahead.
bill is being proposed as an option. So the language of the bill says that this is a single payer option for New York State. But I think one of the really big kind of looming things to point out in this bill is that if you prohibit all private insurers from functioning in New York State, from selling insurance in the state, this no longer is an option. It's not optional for patients or for providers or for doctors.
Yeah, and definitely something that you've seen with things like polling over bills like this, whether it's at the state or the federal level, is that initially when people hear about these bills in general terms, they'll be very supportive. But then once you frame things in terms of like the specifics, like what it will cost and the actual practical implications, then all of a sudden the support for the idea will drop significantly. And you see this, for example, with Bernie Sanders' support for Medicare for All, that he quite explicitly will say we have to abolish all private insurance, right? Which is honest for him to say that that's actually what it includes. But for a lot of people, that's a very radical idea to abolish private insurance entirely. I mean, it's one thing to reform them. There's plenty of criticisms that we can have of the private health insurance industry, but to completely abolish it is most people would not accept that. And so, what is interesting about this New York Health Act is that there's no like explicit abolition of private health insurance. But as you stated, the New York Health Act will cover pretty much all services, and private health insurers are not allowed to duplicate any services that are covered by the New York Health Act. So while there's not an explicit abolition of private health insurance, practically speaking, it's like, well, doesn't it just completely eliminate them without actually stating it?
Yeah, absolutely. I mean, I'm sure that there will still be some sort of odd kinds of plans that exist, things that are like insurance for home health care or insurance for plastic surgery, or maybe insurance for some sorts of like advanced reproductive technology and techniques that tend to not always be covered, things like IVF, or I mean, I'm not sure if that would be covered by the plan or not. It doesn't say in the document for certain yet, and I think there are some things still left up to be decided. But yeah, so we'd still have a little bit of private health insurance. So the authors and supporters of this act can say, well, we're not abolishing private health
Right.
insurance, and that's true. But by the letter of the act, the actual impact of this would be that private health insurance, as you know it, as we all think of it, will effectively be abolished. And so the kind of looking a little bit farther ahead, what does that mean, for example, for patients who have a direct primary care arrangement, where they might actually be out of network for their health insurance, but submit some of those bills to the health insurance and get reimbursed? That health insurance situation won't exist anymore. And that's going to be both bad for patients who would prefer this other type of healthcare arrangement, as well as for doctors who would prefer to practice outside of the health insurance market. And there are quite a few of them. But those doctors, some percent of the patients who see those doctors rely on their out of network coverage to help offset the cost of those healthcare bills. And so those doctors, I think, will also begin to lose patients, and it'll put a huge strain on their ability to practice in New York State.
And what about providers that will try to kind of continue to exist in kind of like a parallel private market in New York State? How would they fare under this kind of system?
Yeah, I mean, I think it isn't entirely clear because just like with Medicaid, this bill doesn't specifically say that providers must be enrolled in the system. So with Medicare and Medicaid, providers are able to opt out. It may be that providers can opt out of this system, but it isn't clear entirely. It also isn't clear, for example, with Medicaid, whether Medicaid patients can choose to pay cash for their medical care. But in most cases, the law is interpreted to be that they can't, because of clauses that say things like doctors will not bill for any covered service. So if this bill says that doctors will not bill patients for any covered service, really what that ultimately will mean in terms of how things function is that doctors will be at risk of fraud charges, fraud allegations if they bill patients cash, even if the patient has chosen to pay cash for any service that would be covered by the New York Health Plan. And that will be really, if that is how this gets interpreted, and it could well be because that's how Medicaid is interpreted in most states, it'll really be the death knell for any private practice physicians.
And even if the interpretation is kind of left up in the air, the vagueness of the law is sometimes also sufficient to deter people from engaging in private practice. You see this in states where the Medicaid laws aren't perfectly clear about this either. Is that why even take the risk?
Right. I mean, I think that will be in a lot of ways what happens. And I think it'll take some time to kind of see how it plays out. There may be some doctors and some providers who do try to get all their legal ducks in a row and have everybody sign all the papers. But at some point, um, it'll be clear that it will become clear because of the way that the government acts and decisions about what they think is fraud or not, whether or not private practice will be something that will continue at all. And I worry that we'll end up in a situation like what a lot of provinces of Canada has, where there's no parallel private option whatsoever. And I think, and we can talk about this a little more, Ray, but I think there are some benefits to having some kind of parallel private option, even if you do have a public option. I think one of the most concerning things about this bill is that there's nothing optional about it.
Right. I think it's relevant for our audience to understand just how radical this plan is, even like comparing it to other single payer options. Like we think like, well, what's the big deal with this act? It's isn't it like implementing what you have in other countries? Well, which other countries, right? Because like you mentioned in Canada, yeah, it, it is much more similar to that, and for that reason, you don't have a parallel private system that can take the pressure off of the public system and prevent wait times and lack of services. I think people also don't appreciate the fact that other countries do have this parallel system uh, in cases like the UK, where it's actually easier for doctors there to operate in both the public and private sector compared to in the US.
Yeah, definitely. I think Singapore is another option where they have both a true public option. It's somewhat needs based, but it still exists, and everyone is able to access healthcare, and a separate private system that and the ability for doctors to practice in both systems. And then, both in the UK and in Singapore, they have a lot of ethics writing and law that kind of encompasses how they expect doctors and patients to behave in these two systems. But I think the ultimate result of that is that there's a lot less fraud and there's better access. And with that private system, you get, as you said, some sort of release valve on the public system. There's a little bit of pressure taken off of it. You also get some ability for um, innovation and kind of creativity and different approaches to how we provide care and things like that, both in terms of how we can save money in the public system and things happening in the private system that then transfer over to the public system as we begin to see that they're more efficient or safer or what have you. And I think this sort of combined system that we have in the US, we are losing out on a lot of those benefits of having a parallel private system. And this bill would just make that worse.
Yeah, and I definitely don't see this problem covered as much with this bill. The main concern that I will see people raising is like, oh well, it'll cost too much, right? Or it'll be too difficult to implement. But what that kind of concedes is that, well, if we could raise the money for it, and if like we had like competent enough bureaucrats, this would be a good system. But that's definitely not what I think. I think even if you could practically implement a system like this, it would not be good. Precisely because it takes away choice for patients and providers, much more so in
Mhm.
compared to that of other countries as well. And I don't think people really appreciate that part of it.
Yeah, I think that's definitely true. And I mean, we could talk a little bit about how it's paid for too. I think one of the main things that the advocates of this bill are saying is that it'll be less expensive to provide medical care in New York City because we'll get rid of a lot of the administrative expenses. And I think there's some extent to which this administrative expense argument is true to some degree, although I think practically it will be a little bit difficult because you imagine what that means is, okay, so now we don't need all of the billing people and all of the the care management people who are figuring out, will this admission get paid for? Will this surgery get paid for? All the people doing the prior authorizations. Although there will still be prior authorizations with this bill, as there are with Medicare and Medicaid and Medicare Advantage plans. But and I think that's true to some extent, but also, a lot of those people are working in unions in hospitals, and so they're just going to find some other place to put them for a while. So I think initially it probably isn't going to practically save that much money. But also, when the government is paying for things, we see that there's less of a concern for increased expenses, just because the government pays, so they don't argue that much about things. And I think I wish it were another way, and I wish it were different, but that's what we see over and over and over again. So I'm not sure that it would actually ultimately save money, that much money in the long run. And that money is going to come out of your pocket. So, your employer won't be paying for your healthcare plan anymore. And I think traditionally you could think of your health plan as part of your salary. But instead, what will happen is you're not going to get a higher salary when the New York Health Act comes into play, because employers are going to be expected to pay an 80% payroll tax on your payroll for you, 80% of your like new payroll tax for this plan. Um, and you'll have to pay the other 20%. And so employers are just going to say, well, instead of giving you a health plan, I'm paying 80% of your payroll tax. So that's where your salary benefit comes in from this plan. And what's going to happen to self-employed people is they're going to have to pay 100% of their payroll tax for their health care. And so, we've been talking for a long time about how the way that healthcare is the tax benefits that employers get for health plans are kind of like almost like you could think of them the opposite way, as like an increased tax for people who are self-employed, because they don't get that tax break, they don't see it. And this is just that, but written explicitly into law.
So, I mean, you're pointing out all these specific problems, but I could imagine someone thinking that, well, this is precisely why we do need some kind of comprehensive plan, right? Like I can be sympathetic to people thinking, look, New York State, like many other states, it's just too complex, it's too arbitrary, it's not transparent. There's all sorts of gaps in which you can fall, like if you are working class and but you make just a little too much to qualify for Medicaid, or you're in between jobs. It's just crazy. And so I can appreciate if someone thinks like we just need a simpler system at the very least. But I think what should also be recognized is that in part the complexity that we have is also a result of resisting any kind of comprehensive plan, right? So like people will come up with comprehensive plans and then they'll resist them, and then you get some like minor compromise, and you just get like one extra layer on top of the system that we already have, and layer upon layer upon layer, and then you get this patchwork system that we have. But I think another way to look at that kind of dynamic and that problem is that it's because we haven't really been given a real alternative, right? If the real alternative is, well, we have complete government single payer, and then the people that say no, and neither is really getting their way, so we get this kind of broken system. Well, yeah, then that's not really working for anyone. But I would encourage people to kind of like rethink what they really want. And what I would want in for my own healthcare is the freedom to choose, right? And not just this like some idealistic ideal like independent from context. Is that I think that that also has practical results, because it allows me to think about my own health with my doctor, and my doctor to think about what they can offer me, and to work with business people to get the prices down to a price that I can afford, right? But you just don't have that right now. You wouldn't have that in the kind of single payer system, and you definitely don't have that in the fragmented system. But both
Mhm.
of those are the result of the kind of ideals that are already on the table. So I would encourage people to kind of rethink those ideals.
Yeah, I mean, I think that's right. I think and I think you can want more healthcare and want better healthcare, but as you push something like this bill, you're really taking options away. You're forcing us into a system that likely will end up costing more. And it'll cost more in terms of money, but it'll also cost in terms of your choices about your own healthcare. And it will cost doctors who want to be businessmen or women in terms of their choices about how they provide healthcare. And, like doctors who are leaving kind of our traditional insurance based, Medicare, Medicaid based system, they're leaving because they want to, for the most part, because they want some sort of system that validates them as doctors, that allows them to take good care of their patients and have a relationship with patients that is health enhancing for everyone. And to force them back into this system that they left, like they're just going to leave medicine entirely, that subset of doctors, I would predict. I mean, maybe some of them won't, but I think many of them will just leave entirely. And I can't blame them for that. I think that is probably a right, um correct choice on their part if they really can't stomach this, being in this kind of more traditional insurance based government funded system where they really don't have they really don't and won't, as it gets worse, have the freedom to make choices with their patients about what to do for their health care.
So, what can we offer people, right? Like, I mean, changing these ideals is like a long-term plan. I know we're not going to sell people on our vision at a large scale anytime soon. I'm pretty
Hmm.
realistic about that. What can we offer them that can, at least to them, appeal to what they think is possible and what they think they need?
Yeah. I mean, I think one big thing is, and we've touched on this in other podcasts we've done, but even just with our system today, doing a better job of allowing a parallel private market to exist, both having a better government subsidized you know uh, market or kind of system in place, but then actually allowing people within either system to make their own decisions about their healthcare, to decide to pay money cash to a doctor to make an arrangement that suits them for their medical care. And I think right now, with Medicaid in particular, patients don't have the choice to see their own doctor, and doctors don't have the choice to see Medicaid patients because of the way that regulations are written in most states. I think, and the same is true to some degree with Medicare, not as bad, but to some degree, it's an issue. Right now, doctors can't practice in two separate settings that are in where one setting sees Medicaid patients and they're opted into Medicaid and they bill through Medicare and Medicaid, and in another setting they see only private patients. One doctor can't do both of those things legally. So I think we have a lot of areas where the the quote unquote private system, the theoretically private system in our country, are so impacted by the public government system that there's really not enough of a difference or differential to allow that private system to offload the public system, or to allow patients and doctors to make choices about how they interact with each other. So I would say a first step would be really trying to cleave those systems and split them so that both can function better.
I think another thing to consider with this whole discussion is that in many ways, the New York um, Health Act is not radical, right? I mean, in one sense, it is in that it would get rid of private insurance, practically speaking. But here at the Center for Modern Health, we're currently getting close to releasing the Freedom Health Index, which I'm not entirely at liberty to say everything about yet. But one thing that I can tell you there is that New York's very close to the bottom, and it's been at the bottom for a very long time. And so, if people want to actually consider an alternative for not only New York State, but many other states that lack in health freedom is how's that really working for you? And maybe consider moving up that ranking.
Yeah, I think it'll be really interesting to see some of the specifics of the Healthcare Freedom Index, which points out specific areas in which states can improve their healthcare freedom. Having it as a goal to have more freedom of choice in healthcare for patients, more freedom to pursue health, is really where we want to try to go. And this bill makes things less free, not more free. And um, I want to see everyone get healthcare, but I don't think this is the way.
Yeah, and I certainly hope that New York State doesn't have to go through with a plan like this in order to discover just how bad it is, and that hopefully they can discover that without going through with it and recognize the value of freedom. And with that, I think that's a good place to end. I'd like to thank you, Colleen, and our audience, and till next time.
Yeah, thank you for having me, Ray.
To stay up to date, subscribe to our show from whatever podcast platform you are listening from. To support our show and the Center for Modern Health, you can make a tax-deductible donation at centerformodernhealth.org/support. Thank you for listening.